Welcome to Beauty Times Medicine, the podcast and video series from Galderma. Here we keep you informed about the latest innovations in dermatology and their applications for patients and consumers. Today, I'm joined by double board-certified dermatologist, cosmetic surgeon, and assistant clinical professor at the University of California, Dr. Sabrina Fabi. Dr. Fabi is a globally recognized leader in cosmetic dermatology. In addition to her involvement in more than 200 clinical studies, she has authored over 250 medical articles and co-authored more than 30 book chapters on aesthetics. She's also lectured to doctors around the world on advancement in aesthetics. Sabrina's accomplished career and expertise give her unique insights into the topics and trends shaping the future of medical aesthetics. Sabrina, welcome to our podcast.
Thank you for having me, Flemming.
When did you realize that cosmetic dermatology was really something you wanted to pursue?
So I realized that I wanted to be a dermatologist first, probably around 12. Like most dermatologists, they fight with something skin related. My dose was eczema and acne. And I realized quickly the impact it had on my confidence, something that seems so superficial, but in fact can impact the way you carry yourself, what you choose to engage in, what you choose not to engage in. I grew frustrated sometimes with how long...
So you early on knew I'm going to be a doctor, and then you early on even knew, I'm going to be a dermatologist.
Yeah, as a physician, I think that medicine is a calling. It's something that you feel like. I knew I wanted to be a doctor since I was 6 years old. And from that place, it was more because of the altruistic desire to help people. But dermatology, 12. And then aesthetic dermatology, when I got into residency and realized that lasers could give you a much faster result than maybe some of the topical and oral formulations that sometimes don't carry as quick of an efficacy or as much of an efficacy.
And this was in different parts of the world, or all in the US, or where did all of this education take place?
All of my education did take place in the US as far as my undergraduate and residency in medical school. But I did do programs abroad. I did a program in Singapore to learn more about tropical medicine through the American Academy of Dermatology at their hospital there, because I was always interested in having a more global perspective of the conditions that affect other people, not just those in the US. And then in undergraduate, I worked on the malaria vaccine. And so through a university program of Maryland in conjunction with the NIH, I went to work in Bamako, Mali. So I've always had an interest in more of an international approach to medicine.
I want to be a doctor.
Yes.
I want to be a dermatologist.
Yes.
And now you move more and more into aesthetics. How did that come around, so to speak?
So aesthetics, for me, it was a vehicle to be able to help people. Dermatology, in the end, it's mostly aesthetic. You see something on yourself, and that prompts you to go see someone because you want it removed. Sometimes it's not conditions that necessarily are going to kill you, like acne or eczema or psoriasis, but they are conditions that affect your quality of life. And so most of dermatology is aesthetic. Of course, skin cancers and other conditions, drug eruptions, those are different, of course. But I saw aesthetics as a way to be able to manage outcomes more efficiently and effectively for patients. Because many of the lasers, and now what we're learning with the injectables, can really change the biology of skin. So in 2007, I started playing with some of the original lasers. And then I wanted to do a fellowship because I wanted to be, if I was going to do something, I wanted to be the best at it. So that prompted me to do a fellowship. And at the time, there were maybe 3 or 4 just solely cosmetic dermatology fellowships in the United States. And I decided to end up in California because when am I going to have this, pleasure to be able to practice in sunny San Diego? And also because San Diego, for the most part, it's the culture there lends to a more open mind around aesthetics.
And how far did you have to go in terms of understanding lasers? Did you need a mini engineering degree on top of your medical?
I know, almost like a mini physics degree, right? I think with the volume that we saw, seeing between my 4 associates then, about 100 patients a day, 5 days a week, sometimes I'd work 6 days. The volume, it's experience, and experience comes with seeing people and seeing cases. And so that put me in a fortunate situation. And then being able to do the studies to see how people would modify settings or protocols in order to get outcomes, that put me in an advantage to
All by seeing patients, you were also doing a lot of research or involved.
correct. And so that was the evolution. Now, in the beginning, for the doctors that are listening to us, I wasn't 100% busy because you have to establish your name and you have to, give social proof that you actually have an artistic eye and have a skill set to give a natural looking outcome that appeals to a demographic. And so that takes time. But I think social media allowed me to propagate my results.
So your name got out there, they knew that you were
Yes.
interested in that. Menopause, how did that become an interest of yours?
So in the end, I think we're into biohacking. This is a certain way that we're doing it. We're learning more and more that many of the aesthetic procedures that we offer are technically regenerative, and we're just at the tip of the iceberg, recognizing their potential beyond just effacing a line or wrinkle. And so I always believed that the treatments we were doing were biologically reversing the changes of age in that individual. And so as I started asking questions, just, in an assessment and asking questions, where are you with menopause? Or are you by chance taking anything to help you through menopause?
Would patients be surprised? They come for a laser therapy and then you start asking them about menopause. Or maybe 10 years ago, it was more of a topic, but today maybe people are more accepting that you ask those questions. But what was the initial reaction? Oh, why is she asking about that?
Yes, it was the initial reaction. I not only talk about menopause, I also talk about their teeth.
Oh,
Because
wow.
teeth support the lower frame of your face.
Yes.
And there are studies in orthodontists that just by putting in implants, you can improve a nasolabial fold or fullness of a lip or a marionette line by 2 points on our 4-point scales that we use in clinical trials. So I try to have a more holistic approach, I guess, with the way I see my patients and how I counsel them.
And when you talk about menopause, there's of course you can ask women that are not yet in menopause, how are you planning for that? So is there like a transition you have to think about or how does that work?
Yes, I agree with you. This is probably the reason I got into it because the average age of the patient I see in my practice is 42.
Okay.
And so I would see people that I could notice that their skin didn't look the same as it used to look because now I've been fortunate to have patients for 15 years. And so I would ask questions, what's changed? Is everything okay? We know cortisol has an impact on quality of skin. No, I'm sleeping well. It's not stress.
Mhm.
So then hormones were a natural transition for me. And, I started asking, and there are surveys and questionnaires that one can offer their patients to get an idea if they're even transitioning. And they're in that phase of life called perimenopause, which can happen 4 to up to 8 years before menopause actually happens, which is when you finally lost your menstrual cycle for 12 consecutive months. But the period beforehand can be quite lengthy.
Do you think this is still a significant unmet need to have that discussion in the US or around the world? Or what's your sense about that?
I think that, Galderma, I applaud because you did this global survey looking at over 9 countries and surveying over 4,300 people. And many wondered why and wanted to learn more from their HCP and were not necessarily satisfied with the information they had on menopause, which is what we learned. So I think that signals to us that there's an opportunity for us to have these conversations.
Another area that there's a lot of talk about now, even Galderma, I've done some, I think, pioneering study in that area, is medication-driven weight loss. Is that a new patient group that is coming into your practice, or how do you see that?
1 in 8 Americans will be or have been on a GLP medication. That's almost the incidence of breast cancer in the United States. And so for me, that's very powerful because that is influencing the way that these patients look, potentially how they benefit from the procedures that I'm doing. So it requires the conversation, because if they come in 20 pounds later after a treatment, it's not that my treatment failed, it's just that they lost this weight.
But is it a discussion? Of course, you have a clinical observation, you see, well, you lost some weight. Or is that something the patients bring up themselves and say, oh, I'm on and I have observed and I would like? Or how does that conversation
That's a
go?
great question, Fleming. They don't always tell you.
Okay.
They don't. I would probably say that 50% of my patients, for as open as they are with everything in me, and I have a closed practice, so these are patients I've had relationships with now, they just don't tell me. Not because they're withholding.
Because they don't think it's relevant, or do you think there's some stigma here?
I think there might still be a little stigma with it, probably even more than hormone replacement therapy, truthfully. Now people are empowered and they tell you, I'm an HRT, you should do it too. It helps cognition, it helps Alzheimer's, all these things. But with GLPs, people want to kind of perhaps take a little bit of ownership over the weight loss. And saying that it's because of a medication, perhaps they're giving it away. I don't know the psychology of that yet. I'll investigate it, I'm sure. But I don't always get that unless I prompt the question.
Okay.
Mm-hmm.
But do you think in their mind, when they come to you, it may be a reason why they seek you out, even though they don't mention it? Or do you think it's happening to them because they're taking these medications and they're already in a routine aesthetic treatment paradigm or something like that?
I think the answer to that is twofold. I think that it does prompt them to come in because of two reasons. One, now they're more aesthetically conscious because they're getting compliments, they're feeling better about themselves. And this is ultimately the medicine of confidence, I think.
Okay.
Right, we're in the confidence medicine business. And so now they feel more confident, but they want to feel more confident with their face too. And so they come in. So that's part one, psychology. Part two, I think they see changes and they don't even realize they're associated with the medication, because that information is not generally known or established yet. So all they know is that things look different. And then you start to ask them and they're like, really, it has to do with my medication? Is it possible? It may be possible. Yes, we're learning as we speak about this right now. And I know you guys Galderma's are really pioneering a lot of the work to try to understand what are the biological changes that are happening at the level of the skin as an organ, beyond what we know is happening at every other organ level.
Are there other areas that you think are emerging in aesthetics medicine that we need to keep an eye on?
I think longevity, we're seeing longevity. People definitely want to improve their health span, the quality of their life, or the length of their life that they lead. And I think with that, we've published on skin span, improving the quality of your skin for the length of your life so that it's biologically youthful.
Mhm.
With that, there's a role. None of these things live in a vacuum. There is a role for GLPs because they have been found to decrease inflammation, which ultimately participates in aging. Menopause, hormones, there's no doubt that fundamentally hormones support the longevity of your body and your skin.
Mhm.
And I think that, a space that I'm interested in is neurocosmetics, which is the impact that we can have on mind and mood by treating the skin. Just like there's a gut-brain axis, there is a skin-brain axis. We know as physicians that the skin derives from the brain, ectoderm, in embryo. And so the connections that we can make to ultimately make people feel better. I think that that's where we're going.
Thank you so much for joining us today.
Thank you.
Very impressed. Thanks very much.
Thank you, Fleming.
So thank you for joining us today on Beauty Times Medicine. Be sure to follow Galderma on social media and Spotify for updates and new episodes. Stay tuned as we continue advancing dermatology for every skin story.